Corewell Health, Helen DeVos Children's Hospital provides care for an entire child, both physical and mental. Here to tell us more about pediatric behavioral services offerings is Dr. Brittany Barber Garcia. Dr. Garcia, thanks so much for being with us.
It's my pleasure. Good morning.
So talk to us about who might be a good fit for pediatric therapy services.
Yeah, thank you for asking. So at Helen DeVos Children's Hospital, we are really excited to be offering outpatient therapy and counseling services for children and adolescents who are facing any mental health challenge or behavioral concern, or maybe a chronic illness concern, who are ages 3 to 18 years old. Our therapists are offering evidence-based services like talk therapy approaches, and are working with parents and families to really support these kids. So if parents have concerns about their kids, whether those are behavioral or emotional concerns, we would encourage you to reach out to your primary care to talk about if it's time for a referral for therapy services.
Okay, so you do need a referral from your primary care physician to access these services.
Yes, absolutely. That's the quickest and most efficient way for us to know that you're looking for care.
Perfect. Okay, so talk about different areas that you focus on.
Yeah, so at Helen DeVos Children's Hospital, our behavioral medicine clinic is now providing psychotherapy services both by doctoral level psychologists as well as licensed masters of social work psychotherapists. Our psychologists focus on serving children with co-occurring medical and behavioral health diagnoses, which means that they're really able to take care of that whole child right at that one point of service and giving them those services kind of where they need them. And as I mentioned before, we recently added 2 LMSW psychotherapists to create really improved access for children who are experiencing any kind of mental health care concern. We're really excited that both of these therapists are what's called trauma-focused cognitive behavioral therapy certified, which means they can support the mental health care for children and adolescents with a variety of mental health concerns, including trauma.
All right, perfect. And so talk a little bit about how pediatric care differs from care of an adult. What does it look like and what sets that apart?
Absolutely. So there are many unique aspects of accessing mental health care for children and adolescents, but probably the thing that we most take into account is that our patients come to us with their whole family, right, as a part of their care team. And so our providers really understand that they're going to be working with both the family and the identified patient to both develop and understand kind of what are the concerns that the parents have, what are the concerns that the child has. The providers are really going to ask questions to better learn about the child's struggles and strengths and work together to develop goals for treatment, both with the patient and their family to really kind of address the whole constellation of concerns. And as pediatric providers, we're of course always paying attention to that unique impact of mental health on a child's whole life experience. So that can be on their child, like their regular developmental skills that they might be working on. That might be the impact on family life, how things are going with siblings and at home. Certainly asking questions and concerned about their academics. Are they making it to school? How is it going in terms of getting through schoolwork? And of course, their social environment and extracurricular activities. We want to understand how are various behavioral and mental health concerns impacting all of these areas of life and work with our patients and their families to best address those and help them return to their functioning.
All right. And for parents out there, how would they know that this might be a time to go see their general care practitioner to get a referral? What are some signs and some things that they should be looking for?
Absolutely. Yeah. So parents know their kids best. You know what your child's baseline is, what their normal behavior is. If you are seeing something that is making you concerned, whether maybe that's your child is acting out more or exhibiting more aggressive behaviors, or maybe your child is seeming to be more emotionally reactive than they have been in the past. Those are signs and symptoms that I'd be aware of. I would also encourage you to be aware of things that are maybe not as obvious in an outward way. So sometimes kids who are experiencing significant overwhelm or anxiety have a tendency to withdraw or pull back a little bit. And so we want to be looking for any signs that kids aren't participating as fully in their everyday lives as they may be used to. Of course, another thing to pay attention to is if you're hearing your child make any statements about being really overwhelmed. You want to make sure you're always having that open line of communication so that they can come talk to you about how they might be feeling, or if they're having any significant concerns about keeping themselves safe, if they're having any self-harm issues, of course, any suicidal thoughts. Please always reach out to access care in those situations. The last thing that I'll mention is that sometimes there can be signs of mental or emotional behavioral concerns that we don't always think of as those things. So sometimes recurrent stomach aches or headaches can sometimes be a sign, not always, but can sometimes be a sign of an underlying mental health concern, like an anxiety, or maybe increased stress in a various different situations. So we always want to pay attention to those things that may not always seem like mental health concerns, but can sometimes be an indication of something else going on.
Wonderful. Dr. Garcia, that's such important information. We really appreciate your time. Of course, if parents are seeing any of those things, make an appointment with your pediatrician. You do need a referral, but you want to learn more about the pediatric behavioral health at Corewell Health. You can go to spectrumhealth.org for more information.